All right, hello, JR with you on KLAM and KCDV. It's Friday, July 16th. We have another daily briefing with Dr. Sanders. Lots of things to cover, and won't spend a lot of time setting them up because they mostly speak for themselves. First of all, our numbers, the likelihood that they're going to grow after the big testing that took place today. And Salmon Jam comes up in the conversations. Things that people can do to beat this back down, the impact of the vaccines and the process for getting vaccinated. All of that is on the way here in the 1, 5, and 8 p.m. hour on the radio, and then we'll get it up to youtube.com/Cordova TV as soon as possible. Well, Doctor, here we are in kind of in the thick of it again. I'm trying to remember all the questions I used to ask you last year when we were doing updates in terms of getting a sense of things. I guess let's start with the number now. What are you expecting in terms of the trend when people look at the case numbers on the dashboard?
Well, we have started the day with 40 active cases on the dashboard. We're doing a large testing event here at the hospital, and we expect those numbers to increase maybe even significantly today as we're doing a large number of testing. One of the things that we've seen with our testing over the last 2 weeks, we've had a 28% positivity with our tests. So with that high a rate of positive results, we know that we aren't doing enough screening tests and we're missing many positive cases in the community. My hope is that today we can get that positive rate down and identify some of these less symptomatic cases that are out there in the community.
Okay. So, and what about the infamous Delta variant? Have we confirmed if that's shown up in Cordova at all?
We do have confirmation that we have Delta variant circulating in Cordova.
Okay. And the characteristics of that are what? It spreads faster, but we don't think is necessarily more severe, or what are the characteristics of it?
So the Delta variant seems to be a more fit variant of COVID. It is approximately 70% of cases that we're seeing in Alaska are Delta variant. It seems to be more infectious. The vaccines, early data shows that the vaccines are still effective against the Delta variant, but not as effective. Here in Cordova, we're certainly seeing vaccinated individuals with all, whether it's Moderna, Pfizer, or J&J, we are seeing these individuals get breakthrough cases of COVID. They do seem to be less symptomatic on average than the cases that we're seeing of unvaccinated individuals.
Okay, and we talked a little bit last time about how, people may think, okay, well, if the virus is breaking through this vaccine, then oh my gosh, they don't work. But it's not being vaccinated is not just about whether or not you catch it. It's about the impact it has, right? And isn't it? Do I remember you saying that there's still a significant near total difference in how vaccinated people respond if they catch it?
Absolutely. We're still seeing nationwide, even with the Delta variant, unvaccinated individuals account for 98% of hospitalization. So we know with any vaccine, how well it works also depends on an individual's immune system and how well their immune system works. We have individuals that have compromised immune systems for a number of reasons. Old age makes your immune system a little bit less strong, as do medications and certain treatments for something. So some individuals are not able to have that robust vaccine response. Those are the individuals that we really worry about, particularly in a setting where we have a aggressive variant spreading in the community. We really want to make sure we protect the high-risk individuals in our community.
Okay. Well, something I'm always interested in is your sort of boots on the ground interaction with people. How do they seem to be reacting to this? Is it making a lot of people nervous, or do they understand it's something that can happen in a pandemic and everybody's doing what they can? What's the sense?
Cordova has been here a number of times. Now, this is certainly the largest outbreak that we've seen. but we all know what to do. And it's excellent to see those things happening. And they're happening really without officials having to come and mandate and create these requirements that we have to wear masks. I am seeing people starting to wear masks again in public.
Mm-hmm.
Right now, we're absolutely recommending universal masking, whether you're vaccinated or unvaccinated. Everybody should be wearing a mask when you're out in public. We do see some people that can have very mild or no symptoms, and you can still be a spreader. So if we're going to curb this, we really need everybody to mask back up, particularly when you're in indoor spaces and with non-household members in indoor spaces. We want people to really think about how they're socializing and try to not mix households, particularly in indoor spaces. So indoor socialization, we know from the last year and a half that that's high risk. That is where we're seeing most of our spreading during this outbreak here in Cordova, our indoor gatherings.
Mm-hmm.
So we really want people to decrease indoor gathering.
Well, now that, of course, brings to mind Salmon Jam, which is, I guess happening now and going on into the weekend. What is your assessment, as you look over their itinerary and their plans and the level of anticipation that they had of the possibility of some spread while that was going on? What's the situation with that from your perspective?
Over the summer, as we had more individuals in Cordova vaccinated and things were getting back to normal, I think that there was probably some early even criticism of why are we not planning a normal Salmon Jam? Why is Cordova not supporting the kind of larger gathering? But the people that planned Salmon Jam recognize that we are still in the middle of a pandemic and the possibility for a large outbreak. So they planned it with that in mind. And the activities are really maybe mildly reflect the normal Salmon Jam in that we do have music, but the activities are really designed in a way that people can social distance. They can participate without having to be mixing households. It's all outdoors, and they're recommending masks to everybody. Mm-hmm. Again, individuals also have the option, if you have any high-risk people in your household, don't attend any events this weekend. Mm-hmm. I think we're at a time where in Cordova, you should assume that everybody around you probably has COVID and interact with them, assuming that they have COVID. Keep distance and keep a mask on.
Yeah, well, that's what we always used to talk about last year. And I'm glad you mentioned the fact that Cordova has had outbreaks before, not as big as this, not with this variant. But we have had sizable ones, and we have beat them back with that exact strategy. When you go out, just assume that anybody who is not in your household is a potential carrier. Respond accordingly with masking and with distance. Nobody at the local level is talking about masking forever. This is until the numbers get back down. There's a lot of national debate about people that are like, never mask at all, and other people are like, we should wear them for the rest of our lives so not one person ever gets sick. And that's a big debate among much louder people. Here at home, we can really focus on the needs of Cordova, and I assume you guys are continuing to do that.
Yeah, so one of the things with masks for really any kind of respiratory illness is source control. So the mask keeps individuals' germs with themselves. Mm-hmm. With COVID, we see some asymptomatic spread. The other reason to encourage everybody to wear masks is just to normalize it while we have this outbreak. We need everybody doing source control, mm-hmm. and to normalize mask wearing so that we can help protect the industry and the ability that we've had to be open and get open and remain with our economy starting to get moving again here in Cordova. If everybody can mask up, it will help us get this contained.
So as far as whether the fact that as you and I are talking, Salmon Jam is still happening, because I would imagine there are some people who think that's nuts. Why on earth are they doing that? From a medical standpoint, given what's been planned, are you able to have an opinion on the fact that it's still going on?
When I look at Cordova and what our risks are over this week and the next 2 weeks, My biggest area of concern is for individuals that test positive. I am pleading with them to follow the public health guidance to self-isolate and stay away from others for that expected 10-day period. Close contacts, right now the contact tracing, we are doing the best that we can. It is very busy throughout the state. People that know that they are close contacts, if you are not outreached by a public health nurse or somebody locally, but you still know that you're a contact, please stay home, don't socialize, and help us contain this. The indoor and the private gatherings are probably Cordova's biggest risk, and then that other piece is the people that know they're positive. Please stay home and don't spread this.
Okay. So as far as the festival itself, though, in your medical opinion, the continuance is not necessarily an irresponsible thing then?
No, I don't feel like it's irresponsible. I think that there are safe ways to attend. Everybody will have the choice if they're up there to make sure that they wear a mask and stay in their own household bubbles. So
Yeah.
I think that this event, it's designed in a way that people will be able to have safe COVID practices and keep themselves safe.
Okay. Let's see. So much to think about here. We talked about safer ways to socialize, predominantly outdoors, and avoid intersection of bubbles again, kind of like last year. The close contacts and the positives really need to stay home. So that's the predominant threat. The indoor gathering, people who are positives that don't stay home, people that are close contacts that don't stay home. Those are really kind of the three main things.
It is, and just recognizing that the contact tracing, although intact, is not quite as robust as it's been during some of our other outbreaks. So please don't take no call from public health as you weren't identified. Help us by self-identifying and still staying home. We will continue to have pop-up testing clinics depending on what the need is. We don't have any planned right now, but just know we will have those periodically over the next couple of weeks.
And then as far as vaccination, how is that proceeding? What's available where, and when can people have that done? Is it sort of continuous or does it come and go?
It's pretty continuous. It comes and goes depending on what type of vaccination we're giving in a given day. Today, we are giving Johnson & Johnson vaccine. We do have a couple of extra doses. If anybody out there is interested in receiving a Johnson & Johnson this Friday afternoon, we will be glad to give it. Please call the hospital clinic. People can call either clinic or the 424-3045 to get signed up for a vaccination, and we're able to get those started pretty quickly once somebody signs up.
Is that same database system that you guys have been using since the vaccination started?
It is. We've used a single phone number and then a single sign up online between the two clinics. It's been very effective. I think we're really efficient at getting people in and vaccinated, and I think Cordova is lucky to have the two clinics working together the way that we are.
Sure. And you mentioned, just for the sake of anybody hearing this on a delay, you and I are talking in the noon hour on Friday, July 16th. So the Friday that you mentioned, for some people, the people that hear it the first time, it'll still sort of apply, but later in the evening, things will be winding down, and if anybody hears it the next day. So again, if they want to know about pop-up tests, if they want to know about what vaccines being given when, or want to get on the list, what's that number again? 3045?
Yeah, 424-3045.
Okay.
And then I want to reassure everybody a couple of things, that when we do testing, the variant our tests do capture the variant. If somebody is carrying the Delta variant, our test will be positive. And if you have been vaccinated, the testing for COVID is not impacted. There's no change in results for our COVID test. If you've been vaccinated, you develop the antibodies. Our tests that we are doing here do not look for antibodies.
Mm-hmm.
So that's really important. We want people to know you still can trust the test, and please come and get them.
And as far as more restrictions, more mandates at this point, is there anything like that on the horizon? If numbers grow to a certain level, are the officials going to have to look at that kind of thing again, or are they really trying to have this be a more individual responsibility scenario based on I'm trying to avoid asking you to speculate on behalf of others, but is there any talk of that kind of thing?
Certainly, I think that everybody's having those discussions. The city is on high alert. We are on a red alert for people to know that this is a very large spreading event. There are not mandates being put into place right now. When we came up with the matrices and the rules that were put into place very early on, at that time we didn't have a vaccine, we didn't have any antiviral medical treatments, and we didn't have the monoclonal antibody. Right now here in Cordova, we have all of those things available. We have a robust set of medical equipment, including ventilators, the BiPAP, CPAP, and high flow nasal cannula to respond to emergencies when we need to. We are in a much better situation than we were a year and a half ago. So I think our triggers for when we decide that we have to really declare a public health emergency and lock things down are a little bit different than what people saw before. Yeah. But we are paying very close attention and hopeful that Cordova has so much experience with this that we'll be able to get through it.
Okay, well, talking with you is always so enjoyable because, it's nice to hear from somebody who really knows what's going on. Is there anything else that you feel we didn't cover? Any other frequently asked questions? Just something you want people to know going into the weekend?
I think we covered it. Thanks for continuing this coverage and helping get the information out to our community.
Oh, absolutely. We're glad to do it. Well, I hope you have a great weekend then, and that you stay safe, and thanks for all the information.
Thanks. You too.
All right. A lot of good content in there from Dr. Sanders here in the 1, 5, and 8 p.m. hours on the radio. And then, as always, we will get this up to our YouTube channel, youtube.com/Cordova TV, as soon as possible. Keep in mind the important web address, covid19.cityofcordova.net. They also use the city's Cordova Prepared Facebook page if you like to follow things on Facebook. Current information is very frequently sent out there. So hope everybody will follow those recommendations. Again, the big ones, the big three: socializing inside with people not of your own household is not a good idea, according to our local experts. If you are COVID positive, you need to isolate for the number of days they tell you to isolate. If you are a close contact, if you know you have been around somebody that's COVID positive for more than about 15 minutes, then you are also asked to not go out and about. And those three things are the things that she emphasized the most as far as what needs to be done. So hopefully we'll do those as we have in the past. Put the mask back on for a while, hopefully just for a few weeks. Because as the doctor said, if we all just do it, then it normalizes even the vaccinated people who are at extremely low risk. If we just normalize it, if we just say, hey, during this period, that's the thing that we're all going to do, and then we can start taking them off once we get past this, then that's sort of the message that we all send to each other. So big thanks again to Dr. Sanders for joining us on today's Daily Briefing. We'll get you back to regular programming here now on KLAM and KCDV.